Hello, I'm Dr. Jack Adrian of ChiroCenter here in Troy, and I've prepared this short video to share important information with those who have been involved in an auto accident. You know, if there is any good news at all about auto collisions, it's that most are not fatal. Of the remaining, the number one type of injury is that of whiplash, also known as a hyperextension hyperflexion injury. The first thing to understand about whiplash is that it's very real. There are more than 1,000 research articles speaking of the validity of whiplash and its negative effects on the human body. Most whiplash injuries are to the neck or upper back, though it is also quite common to occur in any area of your spine. The most common symptoms of whiplash are pain, aching, soreness, or stiffness in the neck, mid, or upper back. Other extremely common symptoms include pain extending into one or both shoulders, pain in the shoulder blades, arm pain, lower back pain, headaches, dizziness, vertigo, blurry vision, lightheadedness, ringing in the ears, loss of concentration or focus, and for some people, depression, anxiety, and/or chronic tiredness. Now, not everyone has the same experience, and you may find only one or two of these symptoms or all of them at the same time. They may also appear immediately at the time of impact, or they may take a few days or even a few weeks before they begin surfacing. And many factors contribute to your unique injury, such as vehicle size, position and angle of your body at the time of impact, angle of the collision, whether you had time to brace for the impact or if it was a total surprise, just to name a few. Now, while higher speed impacts are self-explanatory, whiplash also happens at surprisingly slow speeds. And research into inertia and G-force shows that in impacts as slow as 5 miles per hour, your neck and head can actually accelerate inside of your car between 80 and 100 miles per hour, whip, and then come to a sudden stop in less than a millisecond. So don't be fooled if your accident seemed minor because of slow speeds or little damage to the vehicle. It can truly be a time of great concern because of hidden soft tissue injuries. Now, here is how whiplash occurs. Your head weighs about as much as a bowling ball, approximately 13 to 16 pounds. It sits on the small, vulnerable structures of your neck, much like this heavy shot put on a flexible stick. In an auto collision, the heavier weight of your head continues on through space and then whips your neck, causing the weaker neck structures to experience stress and injury. Even though the neck is designed to move, it's not meant to move at a hyper-accelerated speed beyond normal ranges of motion brought about by the weight of the head and then suddenly stopped. This leads to tearing and compressive injuries to the neck and spine, once again known as whiplash. Whiplash also comes with different names. After an accident, you may indeed have been told you have whiplash, but you may also have been told you have a compressed nerve, stretched, bruised, pulled, or torn muscles, a related concussion, a sprained strain, or swollen and inflamed tissues of the neck, just to name a few. You see, these and more are just some of the concerns that go with whiplash. It's also important to understand that pain is invisible. That's why it can't be seen in certain diagnostic tests, even though it's there. Whiplash left undetected and/or improperly addressed often leads to advancing complications as time goes by. These include time-delayed disc problems, degeneration, arthritis, often weakness, pain, and neurological challenges. The effects are progressive and often develop into permanent consequences. You know, muscles, ligaments, tendons, vertebrae, and other soft tissues of your body react much differently to the trauma of an impact than does the metal, plastic, and glass of your vehicle. Of the more than 1,000 articles addressing the effects of whiplash, research shows that in the vast majority of cases, chiropractic is the smartly chosen treatment of choice, and that no other conventional medical treatment has proven to be as effective as chiropractic. Pain medications and muscle relaxants will indeed relax muscles and mask or cover the pain of the injury, but they do nothing toward correcting the underlying problems. If you've been involved in a vehicular accident, the most important thing is to be checked for hidden challenges, even if no pain is present, but especially so if you are in some kind of pain. Whether it's neck pain, headaches, or a vast array of other challenges found in whiplash injuries. With more than 30 years experience in helping more than 1,000 auto accident victims, I also offer my experience to help you as well. Treatment cost is most always covered 100% by insurance. Our office handles all the paperwork and correspondences, and we accept most cases with or without attorney representation. The choice is always yours. So find yourself giving me a call here at ChiroCenter, and let's you and I sit down together, discuss and investigate your unique whiplash injury, and if found that we can help, begin the treatment necessary to do our best to get you back toward experiencing a pain-free lifestyle once again. The number to call is 339-5556. Once again, from ChiroCenter in Troy, I'm Dr. Jack Adrian. Thank you for watching, and I look forward to helping you.